Welcome back to NorthState Health, the North State's first local health program.
Welcome back. I'm Tim Mapes. Joining us on the show today is part of the team from Shasta Orthopaedics in Reading. Now, since 1993, Shasta Ortho has grown to become the largest orthopedic and sports medicine practice in the North State. Now, we have talked about some common misconceptions about back pain and some simple ways to prevent it. But what if you are at the point that you need surgery? Right now, let's bring in Dr. Brad Jones. He is the spine specialist from Shasta Orthopaedics. Dr. Jones, thank you for being here today.
Thank you, Tim. Appreciate it.
All right. Let's start by talking about how spine surgery has definitely changed in the last 5 or 10 years or so.
Yeah, spine surgery has changed dramatically probably in the last 10 years, and it's usually in a 5 to 10 year cycle that we do see improvements in surgery. One of the biggest things that I think has improved is that we have more predictable outcomes, and these outcomes are typically better, and patients have a faster recovery. And there's many reasons why that is. Part of it is the technology advancements that have actually occurred with the hardware that we use and some of the proteins that we use for actually inducing bone fusions, and also the imaging of how we do surgery is becoming more predictable, and just a remarkable difference. If you go back 20 years and a patient had their uncle, let's say, have surgery 20 years ago, and they're now needing surgery, what we end up telling them is actually explain to them the big difference that has occurred in that 2-decade gap, and to not base a decision on what your uncle or grandfather experienced back when they had surgery 20 years ago. And we can, again, just the key thing is the predictability of what we do, and knowing that once you get the proper diagnosis, you plan the right surgery, outcomes become much more predictable.
Okay, so you really shouldn't base things on what you've heard in the past, because with the technology changing, and it's a lot less invasive maybe?
Yeah, I mean, that's one of the key things too, is our surgery is one of the things was faster recovery, and that is based often on the minimally invasive nature of what we have to offer. Everything from the fusions that we do with rods and screws are being done through smaller incisions, and some of the decompressions. This is an example here of a minimally invasive decompression surgery, and that's literally the size of a dime, and with that we can remove a disc herniation out of the spine. And there's actually newer techniques that are becoming widely used. One of them is an endoscopic surgery. We're actually doing spine surgery on a TV camera, much like we do in a knee scope. And that's a newer technology that even 2 years ago we did not have, and that's going to be coming to the North State here in probably the next 2 to 3 months.
You're watching North State Health, the North State's first local health program.